I'm Hector MacDonald. I am a GP in Port Glasgow Health Centre, and I'm also Clinical Director for Inverclyde Health and Social Care Partnership. In my role as a GP, I've been a GP for 17 years now. There are quite a number of changes that I've noticed over my career and that we face as a country, but also as a kind of as a area in Inverclyde. Everybody, I think, is aware from the press of the ageing population, and with age, I guess we have a population that is living longer, but they are also living longer with many illnesses, and that often means being on many medications which need to be monitored and require a lot of care input, both from doctors and nurses and other health professionals, which is an area that obviously we are expanding. There are certainly differences in the way that people use primary care services now. I think we have a better informed population in a lot of ways due to the internet, but that also has raised the expectations of a very quick access to services. I think computerisation has and use of modern IT has made general practice easier in some ways. The experience for people coming to our practice, patients coming to our practice, well, there are different ways to book appointments and access information now. People can book appointments online, they can order their prescriptions online, they can get health information from practice websites and Twitter feeds. So there are lots of different ways to access information and to engage with the practice now than there were when I first started. I think the core, though, for most people still remains that face-to-face contact with the clinician, particularly at very difficult times for them, when health is very bad or there's really difficult times. I think that face-to-face dealing with someone and being able to empathise is still vital, and that's why I see the role of a general practitioner, I think, is something that's going to be with us for many years to come. Increasingly, other services actually are a more appropriate first choice for patients to turn to when they face difficulties, such as pharmacists, opticians. Some of these tests of change we've had in Inverclyde include people being visited at home by an experienced nurse practitioner or even a paramedic instead of their GP. And where that has benefited people is that they are often able to receive a visit much quicker than they have been in the past by someone who's very experienced.